whole thing because of the contact. And without Floradix, I would have been lost. I use it for canker sores. I use it in pregnancy. I start women on the 20 milligrams as soon as I actually use it for preconception. I start them on 20 milligrams. I may increase them to 30 milligrams at the 28-week mark. It's an ideal product for pregnancy. Postpartum recovery, I use that for the first 6 weeks postpartum. I use it for infertility. And I use it in infants. We know that if, and I use the Floradix in this case, I just give them, I give 5 milligrams to children from 6 months on to prevent developmental delays, because currently it's recommended that all children between ages 1 and 2 receive 10 milligrams of iron per day, because the developmental delays in both things like walking and talking, so mental and physical, may be irreversible. And so it's a very important area to prevent. I've talked about I use it in depression. And one of the things I like to emphasize is that most people start feeling better right away, but the reality is that it takes at least 3 months and sometimes a year to return to your normal iron level. So the mistake people make is they start taking Floradix, they start feeling good, so they go off it, then their energy levels dip back down, and then they have to start back on the product. I tell people that they need to take at least for 3 months at that 30 milligrams if they have an iron deficiency, and then go back to the maintenance dose of 20 milligrams after that. Okay, now I just want to go to some of the questions that commonly come up, and then we're going to move on to calcium magnesium. One of the most common questions is, how do my doctor's prescribed 300 milligrams of iron? How does this compare to Floradix? Well, they're listing the compound weight. They're listing the weight of the iron when they're talking about 300 milligrams. And that only yields about 30 to 50 milligrams per tablet. So to compare apples to apples, we are prescribing 30 milligrams of a liquid, which translates into about a 300 milligram tablet. But we don't see the side effects because we're able to divide the dose up. And we're not getting a whole bunch of iron at once, and also it's a liquid, so there's no tablet to break down, so a lot of iron doesn't end up staying in the intestines. Okay. Okay, so I'm going to move on to calcium magnesium at this point.